This conference will now be recorded.
Hello there. Good morning again. Today's session is how to help your client decide Texas TRS, which is their teacher's retirement system, versus going on to the private market for Medicare. And I'm doing this because one of our agents is faced with a situation where a prospect has approached them for some guidance as to what to do. So I thought I would make this a teaching moment so that we can put up the details of what's going on in Texas right now, so that you can better assist any of your clients or prospects that are in that state that are in this situation. So a couple of disclaimers. I'm not going to read them all. I'm going to literally count to 10 in my head. And if you want to read any of these, you can go back. But I'm going to start that count right now. Okay, so let's talk a little bit about Texas TRS first. What's going on now is, and it actually happened last year, they enrolled everybody that's part of the Teachers Retirement System healthcare plan on Medicare into a Humana Medicare Advantage employer PPO, MA only, not with prescription drugs. They also enrolled them in a standalone Silver Script prescription drug plan, the two together. And then the way that the plan will work for 2019 is there's a $500 deductible, 10% coinsurance, up to $3,500 max out of pocket. The copay, which is not subject to the deductible, for their PCP is $5. Their specialist is $10. Urgent care is $35. ER is $65. Outpatient hospitalization, you have to meet the $500 deductible first if you didn't meet it in other areas. And then there's a $250 copay. Inpatient hospitalization, same scenario. They have to meet the $500 deductible first if they have not met that already. They could have had diagnostic testing earlier in the year, of which the deductible would be assessed. So that's why I say if they didn't meet it. Then there's a $500 copay. The retail cost medications fall into three tiers, tier 1, 2, and 3. And then the 90-day mail order, tier 1, 2, and 3, pricing are there. And then there's a cost for it. Per month for the retiree, it's only $135. And that's in addition to the Medicare Part B premium. So this year, the Medicare Part B premium is $134. Retiree only, you pair it together, is $269 a month with these copays. And then the retiree and the spouse is a huge bite, a huge bite for this year because of the increase, $529 a month. And when you pair it together with the Medicare Part B premium, you're at $797 a month, or $9,564 a year. That hurts. That hurts. So you absolutely can help these people more than you can even imagine. Really quick, I'm going to include this. There's a little cheat sheet that's out there. It talks about how TRS is priced. On the left-hand side is for people with Medicare on TRS, and the right side is for people not on Medicare, under 65. And it talks about how the plans work, the pricing structure, and whatnot. We're going to get into, a couple of different scenarios in just a second of why you wouldn't take somebody off of Texas TRS. But here's your cheat sheet, and this will be made available to everybody in the group. So moving on, what are some of the thoughts to consider? Number one, you got to remember that they do not get a guarantee issue option, or rights rather. Rights would be the better term. They do not get guarantee issue rights for a Medicare supplement simply because they're leaving. Because them deciding to leave Texas TRS is not involuntarily. It's a voluntary decision. So to make a voluntary decision to leave your group plan does not automatically give you the right to pick any Medicare supplement plan without underwriting. It's got to be an involuntary reason. So you got to be really careful. If you're going to go down the road of the supplements, you got to make sure that the people are insurable. In other words, they're able to be underwritten. The other thing you got to consider is once they leave Texas TRS, they cannot go back. That's it. It's like breaking up with a spouse or a girlfriend or boyfriend. Once the relationship's over, it's over. So what winds up happening is they have to sign a form and they have to get it notarized. And in the form, it's very black and white, and it's a statement of understanding that they cannot go back. Once they leave, they cannot go back. If both spouses are on Medicare, my opinion is really only going to be the cost of their medications, which will generally be the only viable reason that somebody would need to stay with Texas TRS. It's really going to be just the cost of their medications. This would apply to someone on expensive medications. And then secondly, if one spouse is not on Medicare, or a family, I didn't include this in the slide, but if one spouse is not on Medicare or they're still supporting a child when it comes terms to health care, you must weigh out the under 65 health costs for the younger spouse. It may make more sense to stay with Texas TRS. It may. It all depends. I mean, here, again, just to bring up the scenario really quick, they have the pricing structure right here. So it may make more sense. You may find that the retiree has a family, and to go on the private market, it's more than $1,000 a month. I mean, I don't know that answer, but you'll certainly find that out by doing a side-by-side comparison. That's the most important thing, is to do a side-by-side comparison. So we're going to look at a typical case, and the reason why we're doing this is to show how you would do the analysis from front end to back. So here's a typical case. The husband is a former retiree, and both him and his wife are on Texas TRS, Humana, and SilverScript. They're both on Medicare. They're in their 70s. The 2019 costs are going to be $529 a month for both of them, and they have voiced that is going to be unaffordable. It's just too much for them. They can pay it, but it'll certainly mean a difference in their lifestyle, having this expensive healthcare cost that they were unexpecting. Thirdly, they are interested in saving as much money as they can on their monthly premiums as possible. They do not financially qualify for any extra help or support. And one of the things that we quickly assessed was that due to their health history, it's going to be difficult for both of them to be underwritten with the Medicare supplement plan. It's very likely the wife will not be underwritten due to her pain medication use. And then the husband has diabetes and high blood pressure combined with a history of complications. So generally what we would try not to do, it's not the rule, it's just a guideline. You don't want to recommend one way of a plan to one spouse and one way of a plan to another. You certainly can. You can give them all their options, but spouses like to kind of go together. So in this particular scenario, it's certain that one is not going to be uninsurable, and it's probable the other won't. We're just going to go down the path of the Medicare Advantage route. It would just be a better solution for them, given their health history, unfortunately. And then finally, as I just said, it's logical at this point to evaluate them on the private Medicare Advantage market. What you would always want to do is you always want to try to do Medicare supplement first. That is just better. It's just better coverage. You know, you can't beat full coverage. But there's always going to be a situation or situations that arise where that's just not going to be viable. And here's one particular scenario, and these scenarios come up often where it's just unfortunately just not viable. Okay. Now, how do you do it? So we're gonna go right into it. You start with the Medicare.gov website as the main source of information. The first thing we're going to do is we're going to enter their medications. Medicare is going to create a code, and you can store that code in the client's file and use it for the future to log in, and the medication list will be stored completely anonymous. You can choose the pharmacy or the pharmacies that they use, up to 2. That the client favors, and you also can consider changing it if it meant saving money. Medicines are priced like any other commodity. It's a supply versus demand. And then a good practice is just to zero in on 1 or 2 plan options that you offer, And what we would do from there is we will look at the plan-specific website for doctor checking and make sure that their doctors are in the network. I'll show you a good practice on how to ensure that. And then you want to use the doctor zip code, of course, to check them in the physician's finder directory. It's better, and it'll help cut down on mistakes. So let's do that. Let's go and start and bring ourselves over to Medicare.gov. So we'll start there. All right. So right here, find health and drug plans. We want to put in their zip code, which is 77539. Don't mess with Texas. Okay. Original Medicare, we know that they don't get any extra help. They do want to put in their drugs. I'm getting texted right now. I'm going to reply and say that I can't speak right now. Okay, so we'll start with the first drug. We'll do the first spouse. So there's a lot of drugs here, so I'm just going to kind of barrel through them. All right, so remember, you want to get the milligrams right. You want to get the dosages correct. Very, very, very important. Okay, very, very, very important. And what's interesting is you do enough of these things, you start to see the same medications that people get prescribed. And I'm going to go off on a bit of a tangent here because this is a pretty tedious task. And I know some of you are either listening to this or watching this. So I'm trying to make this not as boring as possible. But after you do enough of these, you start to realize that people are on the same stuff. And it makes you wonder really what's going on in medical science right now. You know, why is it that I speak to somebody in South Carolina and they're on the same bag of medicine, you know, the same bucket of stuff, and then I speak to somebody in Texas and they're on the same exact crap? Like, why is that? Why are these doctors, you know, just immediately going to these go-tos? You know, it's almost like you turn 65 and all of a sudden you're on this bucket of medicine that includes metformin, that includes this one's 1,000 milligrams twice a day. It includes metformin, it includes a losartan, it includes a statin. I mean, it's like just a package deal. You know, it's like, come on in, be my patient, and let me give you these three. I'd love to be the makers of metformin because it's like half of America over 65 is on it. Makes you wonder if there's really an epidemic. But that's my little 2 cents for the day. These are not necessarily the opinions of others. All right, so oxycodone, another epidemic, painkillers, 10,325. And then pravastatin. She's on quite a bit, not unusual. Sometimes you get lucky, they're on one drug. Other times they're on 10 drugs. It's just a little tedious to put it in. And then it doesn't have the milligrams, so I'll just keep whatever the suggested one is. So all the drugs are in here. If you take a look, right here is the drug list ID. You want to either write that down in the client files. If you're digital like we are, you cut and paste and put it into the CRM tool that you use. CRM tool stands for Client Relationship Manager. So I'm just writing this one down. It's just easier for me right now. Now we're going to move on, and I can tell you one of the things that we didn't ask the individual was we didn't ask them about their pharmacy. So I'm just going to pick two, and I can tell you that with these types of individuals, if it meant going to one of these two pharmacies to save money and they were at a different pharmacy than the two you see here, I can share with you that these individuals will absolutely do that. So here you are. You come to the screen. If you were analyzing a Medicare supplement plan, you would need to do the prescription drug plan over here. You would click here. But here we're going to be looking at Medicare Advantage plans. So we're going to go ahead and click that. And there's 15 plans available. And we're, of course, going to be looking at 2019 plans. Remember, if you've watched any of my previous ones, when you come to this screen, always click the area over here to view all the plans, in this case, view 15. And what this does for us is it kind of sorts it out on the left-hand side, the drug cost on a retail location and a mail order. So obviously this one pops up really quick as a viable cost option, but the agent is not contracted with that particular plan. So we're going to just look at the plans the agent's contracted with. So the person has a PPO. So we're probably going to start with that first. We're going to explain the differences to the client, the differences between the HMO and the PPO. But we're going to start with the PPO first because that's the world that they're coming from. So we're going to pick the two PPOs that the agent is going to be able to offer. And remember, the rule is you can only compare plans you can offer. You cannot compare plans you can't offer. And I'm going to quickly look at the side-by-sides, and I'm going to just mentally compare it to Texas TRS. So if you remember, doctor copays were $5 and $10. In these plans, on the left side, it's $5.35, and on the right side, it's $0.35. So not much of a difference on the PCP, a little bit of a pricier option on the specialist. Moving down, the ER copay at Texas TRS is $65. These guys are $90. Not much of a difference. Over here, hospitalization. Where are you? Outpatient hospitalization coverage. We got $325 per visit, $235 to $250 per visit. If you remember, Texas TRS, you had to meet a $500 deductible. Then it was $250. Inpatient is $325 a day for 5 days. $300 a day for 6 days. So inpatient hospitalization is a little bit more expensive of a risk versus Texas TRS. But here's the winner. I skipped over this on purpose. Here's the winner. Okay, what are these plans going to cost? Okay, well, this one's going to cost $15 a month, and that one's going to cost $15 a month. How much is the Texas TRS going to cost? $500 and something a month. So $529 a month versus $30 a month to spend a little bit more extra in your copays. And when I say a little bit more, we're talking maybe $20 more on a specialist. What do you think the consumer is going to do? What do you think the consumer is going to pick? You think they're going to stay with Texas TRS at $6,000 a year in premiums to have copays? Or do you think they're going to stay or decide to make a change to one of these plans and bring their premiums down to $360 a year? What do you think they're going to do? So now that we know that we can help them with the plans that are offered, I'm going to quickly look at the drug coverage. And if you take a look here, to pick up their drugs on a retail level, on the left-hand side is going to cost them about $83 a month. And remember, they have copays in the Texas TRS plan, $5 for generics and then $25 and $50 for name brands. Looks like most of these drugs, except for the one that starts with the letter N, are going to be generics anyways. And then on the right-hand side, the cost of the monthly drugs are a little bit less expensive. So when you quickly look at the plans between the two, the right-hand side does seem to be a little bit more attractive. But one thing you want to consider is the people are coming from this insurance company. So generally, it makes a bit more sense, not always, it just makes a bit more sense because of their history of working with doctors that you want to kind of keep them in line with the insurance company that they're coming from, if you can. Number one, they're familiar with it. Number two, they have history with it. Number three, they understand how it functions. They've been receiving mail. It's just an easier transition for them to guide them over from one to the other to stay in the same house. I'm not saying it's the rule, but in this particular case, it would just be an easier transition. But your job is to evaluate, what is going to be their absolute best options. Now, one of the things I would consider for here is I would consider having a conversation with the individual about doing a mail order. I would start to open that conversation now. I wouldn't wait until at any point where it comes time to make a decision. So if you convert them over to mail order, their medications are going to be same from plan to plan. The copays look almost identical to me. The pricings are different. So in this particular scenario, because they're coming from Humana already, I'm going to immediately start with Humana and make sure that their doctors accept the Humana private plan, not the commercial plan, so the private plan. 99 out of 100 times they will, but you still have to verify and check. If they do not take the Humana plan, then we will immediately go look at the next one, which is going to be the Aetna plan. So we'll start there. Okay, so let's start there. So you want to go into the provider directory. You should already have these on your desktop, ready to go. We do medical, of course, and then we want to do Medicare. Oh, I did forget. I apologize. First thing we want to do is we want to Google the doctor's name. So we'll do the woman first. All right, so you Google the doctor's name, and a lot of times when you find them, there you go. There's the doctor. It usually pops up over here. I confirm because I have the phone number that this is the exact doctor. So you want to start with the doctor's zip code when you're confirming a doctor in the network. It's just better, and it looks like the system is not working right now. So let me pause the recording, and then let me bring it back up.
This conference will now be recorded.
Okay, sorry about that. I had to go in through a different door. So we brought up the provider directory. I like to just cut and paste. It makes life a little bit easier. Just put in the doctor's information, pull up the search, and it looks like it's not popping up. I'm going to expand the search area a little bit longer, and I did make an error. I didn't put in the see the error right there. I did not put in the doctor's zip code. So for whatever reason, this doctor's not popping up as a provider for 20. Oh, there she goes. It was the first name. So this went last name, first name. So if you saw what I did, I went a couple of different ways to pop the doctor in. And sure enough, if just putting in the last name, she had popped up. I'm going to click show coverage. And bingo. The doctor is considered in network. Here's the plan that we were looking at, this one right here. Bingo, there you go. So generally what's a good practice at this point is you identified the plan that you're considering recommending. You just confirm the doctors in the network. You're comfortable with the drug pricing. You're comfortable with everything. So while you're already here, you might as well just go and get all the plan details. Over here is where you can get the summary of benefits. And pull that up really quick because you do got to go over this with them, and it lists everything out. And I always like to pop really quick down to the extra stuff that comes with these plans, you know, just for mental stuff. I don't get into it in the beginning of the call. I do it at the end. And just kind of a quick little look here. They have an over-the-counter benefit where they get $50 every 3 months for the purchase of over-the-counter stuff. So not only are you saving these people with, I mean, incredible amounts of premiums, you're also giving them $200 a year to spend in the pharmacy for vitamins and supplements and things of that nature. Each. It is a tremendous, tremendous value that you're bringing to the table. Tremendous value. Silver sneakers, it looks like this one is included with silver sneakers, so you're giving them a gym membership. I mean, it's just an amazing, amazing, amazing value. So while you're here, you want to kind of pick up all this information. You need the plan ratings to give to the consumer as well. I guess they didn't publish this particular one, but you need that. You don't need the evidence of coverage because that's a million pages, but you need to teach them how to find all this stuff on the internet. So then while we're here, we might as well go and look at whether or not the other doctor, the husband's doctor, is in network. So we're just going to go back into the screen. I'm going to go ahead and add and search for another doctor, but we're going to Google the doctor first. and I may not have the right spelling, say N-I-L-A, ranks. All right. So you got to kind of mess around a little bit, and I may have to go back to the email because I may not have the right spelling of this doctor. So just bear with me. I know these are like boring moments, so. All right, sorry about that. All right. S-A-N-I-L-A, Rinks, Midtown Medical in Houston. Oh, so it's Rana, not Rinks, Rana. That's why. Okay. See how important it is? You got to Google all this stuff. All right, so we don't have a zip code. Let me see if I can do it this way. Because a lot of times they show the picture of the doctor. I always make a funny joke about their appearance. Okay. All right, so we're going to use the doctor's zip code, 77027. We're going to go back over here, and we know it's Rana now. We'll just do last name, and bingo, there you go. Show coverage. What do we got? And where are we? And we got a jackpot. Look at that. 777s. Both doctors are in the network. Folks, you have done your job at this point. So at this stage in the process, you have entered in their information into Medicare.gov. You came to the conclusion that if they go to mail order, they would save a tremendous amount of money on their drugs. You looked at the two plans that you were able to offer in this county, and you came to the conclusion that they were both somewhat similar in nature. Medications will cost the same. You want to keep the continuity going, either though you can offer the left side or the right side. You can keep the continuity going on the left side. What I'm going to do at this point, though, is since this is training, I'm going to go ahead and we're going to look at the other insurance company, which is Aetna, and we're going to look at their provider directory, and then just to see whether or not their doctors take the plan. So we'll start with this one, 77027. So with Aetna, you got to go through a couple of steps to get to the provider directory. It's just a couple steps. All right, so I went the wrong way. I wanted to skip plan selection and just put in the doctor's name. All right, so what was the S-A-N-I-L-A? S-A-N-I-L-A. All right, there we go. And then over here, you would click See Accepted Plans. And if you take a look, this particular doctor takes all the Aetna Medicare Advantage plans. We'll look at the other doctor and start a new search. And then remember, it's all about the Google. This doctor's name is Cynthia Ripson. Doctor. There you are, Cynthia Ripson. We know that you're in zip code 77573, but we'll see if you pop up close to the zip code. Nope, we got to go and do your zip code. So we got to back out of here again a bit. Oh, here we can change that right there. 7757. You see what a difference makes by putting in the doctor's zip code? It makes all the world of difference. If you don't put in the doctor's zip code, there she goes. She popped up, Dr. Cynthia. Let's see what you accept. And bingo, Aetna, 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 Aetna. So there you go. It's smarter to Google the doctor's name, use the doctor's zip code, double check, and there it is, the doctors in the network. One thing that I forgot to mention is you want to save this stuff for your files. You could just do something like this, save it for your files, so you have written proof that you've done the legwork of confirming the doctor in the network. Good practices, you also want to give it to the client as well. You want them to have this in their hands and so forth. So let's go back here. We've narrowed it down to 2 picks. We know that their doctors are accepted by both of these insurance companies. So now you want to go back to the plan results again. Okay, so you want to go back to the plan results. And I'm going to just pause for just 1 second.
This conference will now be recorded.
Okay, sorry about that. We've had a sick baby since Monday, and we have to bring him, well, not me, but Ashley has to bring him back to the doctor, but he's definitely feeling better, so I had to take that call. So going back, now that we've identified the meds and the plan that they have, and that we identified the fact that the doctors take all the plans, in this case for both Humana and Aetna, we're going to just pick an HMO and a PPO really quick for each insurance company, and we're going to kind of look at the differences. And this is mainly for training purposes as well. You can also have these conversations with your clients as well. So when you take a look really quick on the surface, the plans itself, the PPO is going to cost $15 a month, and the HMO is going to cost $0. Now, key differences, number one, with an HMO, you have to get a referral to see a specialist, and you have to get prior authorization for different services and things like that. And right at the surface, I'm staring at this and I'm seeing no benefit to the HMO at all. The specialist copay is $50. Over here, it's $35. So primaries are 0, specialists is 15 in the HMO. So right there, I'm almost going to shoot this down without even getting deep into it. Hospital copay is the same. Outpatient coverage is the same. Really, there's nothing here that I see. The out-of-pocket in-network is the same. So I'm immediately knocking down the HMO. It's off the table. So now we're just left with the PPO for this insurance company. And let's look at the next one. In other words, when I say I'm knocking it down, there's no value to the client going into the HMO. Okay, so there's one little value. Their medications would be $112 less a year, but I wouldn't put a client in a plan with limited mobility and restrictions and network-only options for $100 of med savings. That wouldn't be wise. So we'll pick the other company, this PPO, and I thought I saw an HMO. I guess I didn't. So why don't we do this? Why don't we pick another PPO from the same insurance company, and you can see why one PPO would cost one price and another PPO would cost another. So let's do that. Really weird the way they price these plans. And I apologize. I feel like this whole training is a little bit on the boring side, but it's a very comprehensive one in a way because you're getting a lot of information. So on the surface, really quick, between the two plans, the left side looks like it's $15. This is the one we have in question. And then the right side is $48. So nearly 4 times as much. But why? What are you getting for 4 times as much? So when you kind of look at the benefits really quick, I mean, I just went right to hospital. The $15 plan is $3.25 for 5 days. The $48 plan is $360. It's more. Outpatient's the same. Primary network in-network is $25. So I'm stopping right here. I'm done. I'm not even going to talk about this one. So back to the original 2 plans. You have the Humana Choice PPO for $15, the Aetna Choice PPO for $15. Both plans are relatively the same. One thing I didn't look or show you guys is the the extra benefits such as the vision and dental. Let me pair that up really quick to the two plans, and then we'll wrap this up, and we'll talk about what you would want to do in a case like this to help further protect the client. Okay. And we're going to look at the value-added benefits. They're down here. And if you take a look for hearing services, it looks like just a hearing exam is covered under Humana. It looks like Aetna covers a hearing exam and a fitting evaluation. Okay. Preventative dental, it looks like they both have exactly the same for preventative dental. That's cleanings and x-rays. It looks like it's all for free. Comprehensive dental, it looks like Humana has some comprehensive, not much, periodontics, extractions, restorative services. Aetna beefs it up a little bit, endodontics, diagnostic services, and then vision, it looks like they're just the same. So between the two, it looks like the Aetna Medicare Choice PPO has a little bit better on the dental side. So what I would do is, in a case like this, as I said before, I would probably lead them down the road to just stay with their current insurance carrier, unless they had a dissatisfaction with them. It's just easier, cleaner. They're used to the system. If they've gone on mail order already, the switch over is very easy. You know, it's like moving your house when you change insurance companies, and you want to try to keep things as simple as possible. If they're really excited about the value-added benefit, especially on the dental side, and they really want to save a few dollars on the copays, and they honestly don't care who the insurance company is, they don't have a love or a hate, then you can recommend the other one. The way that I would pose it to them is I would show them the two options. I would go through, because you have to, I would go through the differences of the benefits, and I would ask them what they want to do. Let them decide. But it would just, in my opinion, it would just make it easier to just stay in the same home. So that's exactly what you would do in the case like this. You're going to save these people a tremendous amount of money, thousands and thousands of dollars per year. And what I would do in a case like this is I would incorporate a hospital indemnity plan. And that way you can close out some of the gaps, especially in the hospitalization area. And as long as these people didn't have a previous cancer diagnosis, which I'm pretty sure they have not, then I would also recommend you do cancer insurance with them as well. If you package that up together, it'll probably be about $100 or so, maybe a little bit more, maybe $150 together. And the two areas that they would be at major risk for would be hospitalization and cancer. And if either of those two things were to happen, there would be an indemnity amount of money that would be paid to them to help cover the cost of those problems. Now, one thing I want to circle back to is I didn't cover this, the health plan deductible. The deductible only applies if you use out-of-network benefits. So one of the things you want to have a conversation with the people about is, do you think that they're going to have out-of-network benefits? The Humana plan for doctors, it looks like they're going to be on the fence for 40% of the cost out-of-network. So on the right side, it looks like they're going to be out of pocket 50% of the cost. So you definitely want to have that conversation. Even though these people can see doctors that do not accept the plan that they chose because it's a PPO, a preferred provider organization, you definitely want to make sure that they understand it's better for them to use network doctors. It's much, much better for them to use network doctors. So we're at the end now. This concludes our training. And what happens next? A little commercial. And that is, if you are part of our network, reach out to us for any additional questions or training you feel you want or need. If you are not in the network, perhaps we should entertain a call to see if we're a good fit for you. We are not a one-size-fits-all. However, we do specialize very detailed one-on-one training and support. And then finally, if there are any carriers that you have seen in this training that you would like to learn more about and see if they can fit in your product portfolio, let us know. This was a long one, folks, but very comprehensive. I hope you got something out of it. Thank you very much.